Chapter 16, Problems of Late Adulthood. The aging process obviously begins at birth, but there are very few signs that are noted until middle-aged, around the age of 50. When time passes, changes actually become apparent and physical maturity is replaced by the aging process. These individuals are known as senior citizens, geriatrics, or elderly. It is believed by 2050 that the number of the United States residents that are over the age of 65 is projected to be at 83.7 million. That is being compared to the 2017 number of 50.8 million. This is why geriatrics has become a specialty in nursing. As a young adult, it is very difficult to imagine becoming old and the changes that come with older adulthood. Throughout the years of developing, people have a fear of growing old, and anything that is associated with aging, it is something that is to be avoided according to the younger generation. Late 30s is when some physical changes of aging are noticeable, but by the age of 50 and there soon after, individuals cannot deny what's happening with their systems, and aging process is very apparent. So signs of aging will continue to develop until someone is in their older adult life around the age of 85. And then if people live past the age of 85, they don't seem to appear to age very, very frequently. There are various changes. One of them is the attention span that one has. It can slowly decline after the age of 70, but if someone practices and works on not being easily distracted, it can remain intact. Cognitive style. So when you think about mental decline, it is obviously more rapid in people that are not flexible. So being adaptable in middle life helps reduce the risk for mental decline. Crystallized intelligence. This is something that can remain intact until someone is 75 or older, but people need to work on keeping their mental faculties and their intelligence at a level. So they need to do mind exercises, play mind games like crossword puzzles, can do physical exercise. As we age, we know that the memories that we have, they seem to change. Long-term memory is better kept than our short-term memory. So oftentimes their long-term memory is due to experience and our knowledge base. As we age, we process information at a slower speed, and oftentimes it may take longer to bring information from our long-term memory up to the front so it can be usable again. When we are trying to learn new tasks, it will take a little longer for older individuals to learn new tasks, and it's just to the fact of aging slows down our body processes. So individuals may not struggle, but it's going to take them more time. As we get to middle age, memory can start to decrease rapidly. And we know that as an older adult, information is processed by associating it to something that they can relate it to. For metamemory, After the age of 40, the adults make a conscious effort to learn and store and remember new information. So metamemory, it can remain intact in older adults when individuals use the intelligence that they have and they lead active lives. Individuals with negative emotions are shown to have a higher incidence of depression, and depression is caused by a loss oftentimes in older adults, and this is seen commonly, especially when someone loses a spouse or a very close friend. We know that our perception, it slows around the age of 50, but it may not be noticeable. And the elderly, it is more noticeable when it has been tested. Personality is something that we establish when we are very young, and it will remain intact and stable throughout life. So oftentimes, if an individual was a happy child, they will oftentimes be a happy adult. We know that our reasoning skills are different when we get to be older, and especially between the ages of 60 to 80 years. We know that through research, it has been shown that people that have active mental lives will decline more slowly than those that are not active with their brain and their cognition. Research has changed the way individuals look at the aging process because it is no longer considered a natural decline in an individual's health as well as their abilities. As we think, perceive, and form memories or learn new skills, there is connections between the brain cells, and these also change and are able to be strengthened. Maintaining a healthy diet with a high level of vegetables, nuts, seeds, beans, and legumes, as well as a lower fat intake, has been shown to decrease the rate of cognitive decline. Older adults, they have to cope with many various changes. They need to adapt to physical changes that just happen with the passage of time, and they also need to learn to cope with loss of individuals that have been prevalent in their lifetime. They also have change in their endurance and the ability to do physical work. Their body needs to adjust to a new routine and a new lifestyle. There's changes in eating patterns because we lose taste buds as we get to be older, and some foods may not taste well. Sleeping patterns also change. Individuals aren't able to sleep necessarily through the whole night. Oftentimes, they may need to get up in the night because they need to urinate. Sexually, it still is very important for many of the older adult population. They now change their focus from having children to just having someone to care for and have an intimate and sharing relationship with. Individuals in the United States, ages 65 and older, they're covered by Medicare, which is a national health care program. Medicare oftentimes will need a secondary insurance because Medicare will cover like yearly wellness visits, routine screenings. They need secondary insurance to help cover procedures that aren't fully covered in Medicare. And many of the Medicare recipients will pay premiums for insurance, but then they need to cover those out-of-pocket expenses like medications and deductibles. Medicaid programs, these are state programs that are designed to help defray some of the costs or the expenses for people who can't meet the cost of Medicare contributions, or those that may have used up all of their Medicare benefits. Health services are available and affordable, but when individuals don't have transportation, a visit to a healthcare provider is going to infrequently happen. As individuals that live alone or have sensory difficulties, thinking of hearing, eyesight, they're not able to oftentimes have healthcare services provided because they have specific obstacles that they have to overcome. Other problems are concerned related to HIV and AIDS. This is something that is emerging in the older adult population. Approximately 17% of all individuals that are aged 50 and older are known to have HIV or AIDS. In today's society, growing older has become very impersonal because family and close friends now live miles away and can't be readily accessed. So older adults will often have problems that are related to money, food, housing, healthcare. Many of the older adult population benefit from various interventions related to healthcare. And nursing, because of our focus on activities of daily living, we're able to still provide the necessity and adequacy of activities of daily living for the elderly population. Financially, older adults differ greatly from younger adults because in their later years, people that learned how to cope during the Great Depression of the 30s, they can recall when there wasn't adequate food and there was a scarcity of it. And due to inflation today, the value of our currency in the United States has changed, and it's often difficult for older individuals to discuss their finances because they don't have someone they know or trust well. That is why, as nurses, it is necessary that we have use courtesy and politeness as well as empathy when we are thinking about and conducting an interview related to an individual's financial means and assessment, because many of the older individuals are on a fixed budget or an income. So our elderly population are vulnerable financially. They also are very trusting, and they're often the ones that are involved or taken advantage of related to scams and stealing money from them. Many of the older adults still live in their own homes with a spouse. However, the numbers do not account for elderly individuals that have no homes, because homeless people are very hard to access and actually count the actual population. As older individual population increases, there are new living arrangements that are being developed, and thinking about independent living centers, foster homes, subsidized housing, assisted living situations, so that way there's adequate housing options for the elderly population. With time passing, many adults will lose their individuals that have been important to them in their personal relationships. Therefore, they have little emotional support. They will also lose physical stamina and endurance. And then they will have a loss of their different senses, whether it is smell, taste, or touch. And this can present many challenges for the older adult. Some common problems for individuals that are greater than 45 years of age. 75% of the individual population older than 45 use some kind of prescribed medication. 30% or greater will use some over-the-counter medication. 30% of all prescriptions that are written are for individuals over the age of 65. An average 65-year-old will take 3 to 5 medications per day. Oftentimes, older individuals will share medications or skip medications to help reduce costs. Much of this population does not understand the knowledge behind the medication, therefore they don't know why they're taking these medications. They have little or no knowledge of side effects or medication interactions. The older adult population will tend to have more than one physician, so it is vital for their healthcare providers to understand and communicate with each other so they know what each physician is prescribing. Oftentimes, senior citizens may mix over-the-counter medications with their prescription medications. This can cause great issues for their health. Polypharmacy, this is a term that is used to define when an individual uses 5 or more medications a day, or they may have an unnecessary or an excessive use of medications. We know that older adults metabolize and excrete medications more slowly because kidney and liver functioning is less effective as we age. For mental health, we know that individuals have memory loss issues. This helps increase their vulnerability to scams from people. We also know that elder abuse is on the rise. We know that this age group can suffer from dementia as well as Alzheimer's disease. Our older adult population, they look at the world differently than younger individuals. Oftentimes, these individuals are lonely because they have no close family or friends, and when someone shows an interest in them, they're easily trustworthy. So they want to trust that individual. That makes them extremely vulnerable and open to financial scams, and they are open to assaults and are easily become abused population. Oftentimes, you may find older adults that are neglected or abuse themselves, and they have an underlying medical problem, maybe depression or dementia. There are 3 categories associated with elder abuse. One is domestic abuse, where the abuser actually has a very special relationship with the elder individual. There is institutional abuse, where caregivers that are legally obligated and responsible to provide protective care don't actually protect the older individuals. And then the third one is either self-neglect or self-abuse. So we have to think about the words abandonment, where we leave someone that is unable to care for themselves alone and they don't have basic resources. These individuals are vulnerable for exploitation, where someone will actually use the individual for their own profit. So theft of objects, or theft of finances, or abuse of legal power, anything that provides gain for the individual from that older adult. We see sometimes neglect in the older adult population, where their physical and mental needs are not met. We can see physical abuse, where there's actual harm that is caused by another individual, whether it is maybe beating or cigarette burns, fractures. We see psychological abuse, where there are threats to the mental health of individuals, whether it's related to poor personal hygiene, environmental conditions, threats of putting them in a nursing home, humiliating them, or isolating them. We may see self-neglect where the individual won't provide for their own basic needs. This population is easily exploited sexually. They're open to unwanted physical behaviors, sexual behaviors, and verbal sexual behaviors. And we see their violation of the elder individual's rights because another individual will not permit them to exercise their rights, whether it is refusing treatment, consent for medical treatment, living in an environment that is safe and that is their choice. When individuals experience loss through death, retirement, or relocation, they will lose their social supports. During this time, they will have stressful emotional tasks that they need to be able to manage. If they can't manage them, these older individuals will often become sad. If this emotional state will continue, their outlook to them is bleak and hopeless. And we know that when a darkened mood becomes overpowering and reaches into every aspect of an individual's life, they can often become having feelings of powerlessness to actually do anything related to their bleak mood. And this will actually lead to depression in an older adult. Depression in an older adult is often underdiagnosed and undertreated because there are vague complaints that are the only clue. And sometimes depression will actually be masked as a physical illness. We also understand that signs and symptoms of depression can mimic dementia, which is loss of multiple abilities, including memory, language, and understanding. So as a nurse, we need to do a careful assessment to distinguish between depression and dementia. Antidepressant medications also have various effects because the clientele may often experience unwanted reactions or toxic accumulations in their systems. The SSRI antidepressants actually have decreased amount of side effects in the elderly individual compared to other antidepressants. There are various activities of daily living that can be affected in the older individual when they are in a state of depression. Not getting up and getting dressed in the morning, maybe leaving the bed unmade, not doing their activities of daily living, brushing their teeth, no longer watching favorite TV shows, decreased appetite with weight loss. They may have an odor that is due to a decrease in their hygiene. As nurses, we need to have and provide validation therapy that actually acknowledges the individual's feelings by using eye contact, touch, mirroring the client's body movements, matching the client's voice and their rhythm patterns, showing empathy, putting the patient's cues into feelings about putting their cues about feelings into words. We should accept our client without passing judgment, and we should be empathetic and use active listening. We also need to make sure that these individuals that are taking antidepressants have been educated. So when they arise from a chair or a bed, they need to do so slowly. We understand that a therapeutic effect for antidepressants may take 1 to 3 weeks, but we need to make sure that we educate the elderly population. They should use caution when driving. They should never discontinue any medications without consulting their physician first. And like everyone else, they should avoid alcohol, especially when taking antidepressant medications. When we are doing an assessment of an older adult, we need to make sure that we do a functional assessment as well. This type of assessment is an analysis of the individual's ability to actually perform their own activities of daily living. We also look at their environment where the individual lives, and we consider any culture and social patterns. All of these need to be assessed when providing a functional assessment. Some memory recall is part of the aging process, and it can become difficult. This is when we know that individuals will have difficult time and inability to recall certain events or details. Music therapy is providing a powerful tool for maintaining and restoring health, and it is great for elder care because music can alter moods, provide relaxation, and we can provide them with music that they grew up with and that they enjoyed and remember listening to. Common complications that are seen in elderly individuals are movement disorders as well as cognitive deficits. Cognitive deficits can also impair activities of daily living and making the elderly individuals needing assistance with grooming. We should provide interventions and looking at improving their diets and increasing physical activities. We know that there are new therapies being used, such as using dolls and stuffed animals to provide comfort. This is known as doll therapy. Also, reminiscence therapy is being used, and this looks at an individual's life and helps them to recall things that have happened to them in the past. As a nurse, we should also assess for changes in social, emotional, behavioral, as well as physical functioning, and we should intervene when necessary early in the adult stage. All nurses will actually play a major role in the mental health care of our elderly population.